Before we start, I'd like to let everyone know that we are recording this session, and this is for the benefit of everyone here today in case you want to go back to some of the slides and to what was said, and also for the benefit of others who are not able to join us today. And this recording, including the slides and handouts, will be posted on the EHDI RFP webpage. Not immediately, because you still have to work on them, make sure they're accessible, but please keep checking the EHDI RFP website for all these materials. They will be posted there. Okay, so today's skill building session, these are the topics that we will cover this morning: the different models and practices, selecting your model or practice, adaptations for models and practices, and telling your story. So as the description for this session in the RFP says, this session is for potential applicants who want to understand the different ways practices and strategies are classified to show their effectiveness. So you have research-based, promising, emerging, and practice-based models or practices. And also, this is for potential applicants who want to learn about the different ways you can tell your story in your application and what's the best way to tell your story in your application. So our learning objectives are, by the end of the session, we hope that you'll be able to understand the different ways models or practices are classified, learn what EHDI considers as promising and research-based practices, learn about the cultural adaptations that you can make to models or practices, and then learn about the different ways to tell your story in your application. So what is the relevance of this session to your application? This session, skill building session, is relevant to your application in the project narrative part of the application, specifically in questions 8 through 12. And it is in these questions that you will be asked to describe your strategies, describe your activities, how they fit your priority health area, and how your activities and strategies are based on the cultural knowledge, wisdom, and community lived experiences. These are also where you will be asked to how your strategies and activities were co-created with the communities that you will be serving, and then also how your proposed project fills the unmet need or gap in the field. So these are exactly the narrative questions in the application form. I copied them exactly, but so they will be there in the application form. And so to begin with, I'd like to start by providing a framework for how EHDI views evidence. So this evidence framework is a way for you to think about evidence within the context of EHDI. So for this EHDI grant, you can use all three types of evidence alone or in combination with another, or a combination of all three types of evidence. But if there's one thing that we would like you to take away from this skill building session, it's that EHDI considers community experience, community expertise, and community context as more important than research-based or scientific evidence, because you have lived the experience, you live in the community, and therefore EHDI considers those things more important than using research-based evidence. So all three are considered evidence within the context of the EHDI, but rigorous research is less important than either context or community expertise. So this is really to recognize that every community is unique in its own way, and that in most cases, context and experience or expertise together can provide a stronger case than either a combination with research, because your community residents have lived in it and also have lived the experience. So these are the three things that are in that framework: expertise and experience, your collective experience and expertise of the people who have practiced or lived in a particular setting. Context: what are the community factors likely to influence the implementation of your strategies and activities? And research: what are some published results, quantitative and qualitative, that you can use? Okay. Now, in this session, we will be using the terms model and practice interchangeably. So what's the difference between the two? So I would say bottom line is a model is it's a bigger, and then practice is a subset of that model. So if you're going to use, for example, an evidence-based model, usually that is an organized and multi-component intervention. And that intervention is comprised of several components. It describes the target population for which that model was developed. It describes some core components. It has some expected outcomes. And then it also specifies what organizational supports you will need to be able to implement that model. Now, a practice is more specific. So it's really a specific skill, technique, or strategy that is part of a larger evidence-based model or program. Now, for example, let's say you plan to implement a teen pregnancy prevention program, and that you are using, let's say, an evidence-based model out there that's available, or an evidence-based model that has been adapted to your community. So let's say the name of the program is Teen Choices, for example. That's only an example. So it is a teen pregnancy prevention program that's an out-of-school time program consisting of 4 components, for example. So that model will have the teen pregnancy prevention curriculum itself, where you will do some classroom instruction. It could also include some academic enrichment activities. It could also include some youth development activities, and it could also include some skill building activities, for example. So all of that is describes the model, the teen pregnancy prevention model. But then within that model, you might also have some evidence-based practices. For example, best practices for recruiting or training or retaining youth, best practices for engaging youth, or best practices for engaging parents in the program activities of that model. So that's just a very brief description of what model is versus practice. Now we will be providing you with 3 handouts to accompany the skill building session. And this is just a screenshot of what that handout will look like. But it just shows the continuum of research-based and promising practices. And then you have the characteristic on the rows. And then in the columns, you will have things like evidence-based practice, evidence-informed practices, promising, emerging, and practice-based evidence. Now, research-based practices in the EHDI RFP are the first 2, evidence-based and evidence-informed. And then promising practices in the EHDI RFP are the last 3, promising, emerging, and practice-based. And so you will have a copy of that handout. You don't have to learn about this now, but you will have those in the handout. And again, that handout has describes or differentiates the different types of models and practices by characteristic. For example, how do these 5 types of models differ by type of evidence? How do these 5 types of models or practices differ by research design? So all that is in the handout, and that's just some extra information for you if you want to learn more about those. And then we also have handout number 2, which looks like this. This is a checklist of what criteria you can consider when deciding what program or model to select for your application. Let's say you're considering program A or maybe you're considering between two types of programs, or maybe you're considering between three types of programs. How do you select the best one for your population and for your priority health area? So this checklist just gives you some criteria that you can go through and check if it applies. So let's say my program, do the program goals and objectives reflect what our organization and stakeholders value? Yep, check, we have that. Program goals and objectives, do they reflect the values of our organizations and stakeholders? Is it culturally appropriate? Does it match our community's strengths and needs? Check, no, maybe. So this is just a checklist that you can go through to decide if you are considering several programs, or maybe if you just want to know how strong your program is, then you can use these criteria. And one thing I want to emphasize is this is optional. So if you want to use this checklist, you can, but you don't have to submit it with your application. And also your application will not be scored based on the, which criteria you have check marks on. So it's not for you to submit. This is just something you can use on your own. So in that handout, I mentioned three major criteria for how you can assess the model you are considering. It could be something you developed or something that you really like that's available out there. So these three major sets of criteria are community, organization match, quality, and resource requirements. So the long-term success of a program really depends on the program being not only a good one, but also it has to be the right one for you. So oftentimes there are fads that everybody seems to be doing. For example, you went to a conference and everybody was talking about this this great program and how they've implemented it, and because everybody was talking it, you want to use the same program. You go back to your organization and say, everybody's talking about this program, let's use it. So we just want to advise you to resist that urge, because it might not be the right one. So the bottom line is what matters most is, does it fit and does it feel right for your community or for your population? So it's important to select program strategies that fit with your organization's goals and values, your community setting, and also the needs of your target population. So, and it's not always easy to determine, is it the right one for our particular setting or for our population? So hopefully this checklist can help you do that. So some things to consider, for example, under community organization match. So is the model we're considering, or the approach we're considering, does the goals and objectives match what our organization and participants value? Is it culturally appropriate? Is it based on our community's strength and needs? Is it of a sufficient length and intensity to be effective with our group of participants? Can participants make the time commitment? For example, the model you're considering is, let's say, 20 sessions for 4 weeks. Now, do we think our participants can make that time commitment to attend those 20 sessions within a 4-week time period, for example? You can also ask yourself, does it have a demonstrated effectiveness with the population and the setting that are similar to ours? Can be implemented as is, or do we need to make some adaptations to that model? Does it complement our current programming within our organization or within our community? Now, the second set of broad criteria is about quality, and these are some questions you can ask yourself. So is the model or approach we're considering, has it been shown to be effective? And are we satisfied with the level and quality of evidence of effectiveness of that model? What are the populations that it has been shown to be effective? Has it been shown to be effective with our specific population? And what has been the experience of others who have used that approach, have used that model? And then if you are using an evidence-based model or an adapted model that someone else has developed, do they provide training? Can our staff do the training? And then do they provide technical assistance? And what are some acceptable adaptations? And is there some adaptation assistance that they can provide? And so I will talk more about adaptations later. And so the third set of broad criteria category is resource requirements. And these are, again, some questions you can ask yourself. Is the approach that we have selected, what's the cost of the training our staff? And do we have to buy the curriculum? And then what are the other associated costs with the implementation? Can it be implemented within our time frame? For example, the EHDI time frame is 4 years. So is 4 years enough for us to be able to implement it well? And then can we get results for us to know if what we're doing is working well? Can we afford to implement it long term? So that's a sustainability issue. If the EHDI funding ends, can we still implement this on our own? Do we have staff qualified to implement it, or do they need additional training? Do our staff show enthusiasm and commitment to this? And lastly, do our community partners and stakeholders support its implementation? Okay. So we have a poll for you, and Christy will help us launch the poll. So given what you have heard so far, what model or program will you be proposing in your EHDI application? And you have 5 choices. So are you going to propose an evidence-based model that you are familiar with and implement it as is? Or are you going to propose an evidence-based model that has been adapted by others to your own culture? Or are you going to use an evidence-based model that you will adapt yourself to your own culture? Or are you going to propose an original model or program that you developed yourselves? And then lastly, undecided. If you're undecided, that's an okay option too. So Christy, is the poll ready? So just give everyone.
Yeah, the poll is on, so you can see on your bottom right, I think, on your screen. So once you select a choice, you can hit submit.
Ooh, I don't think I see it, Mohammed.
I think it might depend on your setup. Let's see. Maybe others can let us know in the chat if they see the poll, if other participants can see. Awesome. It looks like folks in the chat are indicating that they can see the poll.
Okay, great. And can we have the results of the poll? Mohammed, are you able to see it?
Yeah, maybe Christy can let us know, but I believe once the poll closes, I think we can definitely share, we might be able to share the results.
Yeah, I think we can close it now. Oh, sorry, I don't see it. Mohammed, do you mind letting us know the results?
Yeah, I did post the results. I don't know if you guys can all see them.
Yeah, so it looks like majority said that they are undecided, about 28% of the folks that did the poll.
Okay.
We have a tie on B and C. So evidence-based and original, develop your own plan, has about the same results, 15%.
Okay. All right.
And A only got about 6% or 3 of the votes.
Mhm.
evidence-based.
Okay. All right, thank you. So yeah, so undecided, that's perfectly fine at this point in time. If you're still undecided, that is fine, and that's why we're here today, to hopefully help you make that decision. Okay, so I mentioned earlier cultural adaptations. So what does adaptation mean? Adaptation is really the process of making changes to an evidence-based model or practice so that it suits a particular population, setting, or structure without deleting its core components and compromising its effectiveness. And so some core components that are usually adapted include what's being taught, like the content, and how it's being taught. Is it taught in the classroom? Do you do role play and things like that? And then also logistics. What's the how many sessions? Is it like 10 sessions? And how often during the week is it held? And then how long is it session? So those are the core components that are usually adapted.
Mia, can you please reshare your screen, your slides again?
Oh, it's not showing?
Mia,
Once we
I'm
did the
sorry.
poll, I think it kicked you out.
Yeah, when we end the poll, it's
Oh,
gonna, so every time you'll have to share. Sorry about that.
okay.
Mia, you're sharing your whole screen. Oh, now we're good to go. Okay, it looks good now.
Okay, good. All right. I think I'll go back to this slide. Um, so uh, so those are things that you can adapt. And then why do people sometimes adapt the model or practice that they have obtained? So it's sometimes you make adaptations because it doesn't fit your population or setting, or there were some concerns raised by staff, your participants, or other stakeholders about certain components they don't agree with, or sometimes you just know that you can do better, and so you adapt it to make it better for your population and your health area. So examples of adaptations that are encouraged are adjusting activities within the program to make them more suitable for your culture or make them more fit better, making adjustments to account for organizational limitations. Oh, sorry about that noise. Sometimes the scheduling doesn't work for your population, or certain things that you can and cannot do. So, but there are also some adaptations that are not encouraged. For example, if it's 20 sessions and you want to shorten it to 10 sessions because the facilitator got sick and so was unable to complete it. And so for reasons like those, it's not encouraged to make the adaptations. As long as it's the adaptations you make do not compromise the effectiveness of the practice or model, then you can do it. Okay. And so, and here are some adaptation examples. For example, if it's a participant issue, we were able to recruit fewer youth than anticipated because many of them have after-school activities, and some parents did not approve of some of the topics, and that's why we changed some of the topics. It could be a staffing issue. We didn't have the required number of mentors for the number of youth, so we shortened the minimum time that each mentor would spend with their mentee. It could be a community issue. We had to eliminate 2 sessions because the community did not think the health issue was a priority when there are so many more urgent issues going on. A few more adaptation examples. You can change the setting. For example, the location of the program was changed from a school to a community center because we have a very strong relationship with the center and would have better luck recruiting participants there. evaluation issues. The principal at the school would not allow us to collect data on student sexual behavior, so we eliminated some questions from the model program survey. It could be a sustainability issue. That's why you adapted it. For example, two key community stakeholders who are respected elders said they could fully support the program only if the content of those 2 sessions was modified. So those are some examples of adaptations you can make. And then how do you evaluate models and practices in the application? There's a question about how you will evaluate your approach, your model. So if you are using some evidence-based models or adapted evidence-based models, they usually come with a manual, and sometimes they come with the tools also, including evaluation tools. So it might come with pre-post tests or surveys, for example. And then if they have been adapted, usually they also come with these tools and manuals. But if you're using a model, practice, or approach that you yourself develop, then you have more leeway in what you can do and what you can measure and what kinds of tools you can use. So you don't have to necessarily use the tools that the developer developed. And so you can refer to the RFP appendices for more examples of how you can evaluate your program, your EHDI program. And it has some examples of specific objectives and strategies. It has examples of outcome measures and indicators for specific priority health areas. Okay, so we have more examples. And I think you'll like this because it's based on actual examples or a combination of actual examples that I've come across. So we have 4 scenarios for you today. And we will also do a bit of a role play. So you will play the role of an application reviewer. So let's say you were in reviewing applications and you came across these descriptions. So how will you assess this particular response in response to the question in the application? So first scenario, we learned, let's say the applicant wrote, we learned about this evidence-based model approach at a conference session, and it will fit our objectives for this project well. We plan to use this approach in our grant and with our population. So if you are an HDI application reviewer, how will you rate scenario 1? Is it a very strong rationale? Is it somewhat strong, or is it just okay? And I would also like to add that the EHDI application review criteria do not use these these choices. Your responses in the application will be rated on a 1 to 5 scale, 1 being unsatisfactory and 5 being excellent. So just for the purposes of this presentation, I chose easier scale. So it's your choices are only very strong, somewhat strong, and just okay. So Christy will launch this poll. So if you were an HDI application reviewer, how will you rate this scenario? Okay. Christy, I think we're ready to share.
Hi, Mia. I'm sorry, it's not letting me do the next question. Can we have people comment in the comment section?
Oh, yes. Yeah, that's fine too. Yeah.
Thank you.
Please. Yeah, please. Yeah, we can't do the poll, so you can just post your answer in the chat.
And if you can reshare your slides again, Mia, that would be great.
Okay, let's go back to here. Okay, I'll just hide this. Okay. All right, so this explanation above is just okay. And so it has pluses and minuses. A big plus is that you said it fits your objectives. You heard about this evidence-based approach at a conference, and you think it really fits your objectives. So this is one plus, but there are also some minuses. One, it hasn't really been tested with your population. And then another minus is that you did not describe how it could or would be tailored to your population. Okay, I have another scenario here, and I think we'll just skip the polls, but you can answer on your own, and then I will tell you the answer later. So another scenario is this approach has been used by our organization in a different program for a few months. And although it hasn't been formally evaluated, we have heard from participants in that program that this has helped them take care of their health better. So as an EHDI application reviewer, how will you rate scenario 2? Okay. And so this is the answer. So the description of this approach is somewhat strong. A big plus is that you already have some experience with it. You said it has been used by your organization for a different program for a few months now. And then you have heard from participants that it really works. So that's a big plus. But then one minus is that there's really no documented evidence, either qualitative or quantitative. You do not provide some evidence. And then it's not necessarily the same population that you're targeting. So let's say this program has been implemented in a diabetes participants in your program, but then your EHDI priority health area is heart disease, for example. You using a program that's been used with diabetes participants and may not necessarily be a right fit for your heart disease participants. Another scenario here, this approach was developed with our community elders. Our diabetes program has been using it for several years now. And over time, we have adjusted certain elements so that it fits our clients. Our years of evaluation have showed it is effective based on participant data. And you can say that you have data from pre-post tests, focus groups, or case management notes. So as an EHDI application reviewer, how will you rate scenario 3? Is it very strong, somewhat strong, or just okay? And the description of this approach is very strong, and you have a lot of pluses here. One, you described how and who was involved in creating the program or intervention. You have several years of experience with it, and efforts have been made to make it fit your clients. And then you know how well it is working because you have done multiple forms of evaluation, so you know it works. So a description such as this one is very strong. Another scenario, a longtime organizational partner has been implementing this evidence-based program called Diabetes Prevention Program since 2015 and has shown it to be effective with their immigrant patients. We have referred our clients to them in the past. Now that we have expanded our health program to include diabetes prevention, the DPP will fit our program well since we're similar in size to our partner. We also serve immigrant populations, although we serve specifically East Africans, and we are very familiar with the elements of DPP. So is this very strong, somewhat strong, or just okay? And the description of this approach is somewhat strong. And why? Because you have familiarity with it through your longtime relationship with that organization, and they have shown it to be effective with their diabetes patients who are immigrants. one minus is the same size organization does not mean you have the same resources. You might have different types of resources. You might have a different amount of resources available, even though you said you're similar in size to that organization. And also, you specifically cater to East Africans, and they might have different needs from a general immigrant population. Okay. So in short, everything has to tie together, and that's a big tip for building a case for your project. Your activities has to tie with the disparities you describe. Your strategies has to tie in with the disparities you describe, and both your activities have to tie with your strategies. So and you can look at some examples in the RFP about some work plans, so how you tie the activity strategies and disparities. And one recommendation is that you do the work plan first before you complete the project narrative, because the details are in your work plan, and you'll be able to describe them better in the narrative if you have finished your work plan. And even though we have character limits, you can really say a lot within those character limits. Like, for example, the longest scenario I described was 501 characters, and question 10, for example, has a limit of 2,500 characters. So just use them up to be able to describe your work better. And then really demonstrate knowledge of your community or target populations. So relative to the health disparities that you just described, what has worked, not worked, or will work well to address these disparities? What are the cultural knowledge, wisdom, and other assets that you possess? How will your activities build on these community assets? And this is the last part of my session today. We have another handout that looks like this, building a case for your project worksheet. And it just contains some questions you can ask yourselves. On, are we really building a strong case for our project? For example, how do we know this work is important and impactful? How do we know that we are trying to address what we are trying to address is important to our community? How do we know that what we want to work on will reduce health disparities in our communities? How do we know that what we are proposing works? Where does our information come from? So this is how do we know? And then the next is how do we show this work is important and impactful? Some questions you can ask yourselves under this are, what are the data that support the importance of doing this work in our communities? What are the stories that support the importance of doing this work in our communities? Which data and stories do we prioritize so we can paint a clear picture of why this is important and how your project will help reach your goals and outcomes? Then how do we evaluate what we do? So what are we really trying to change here? How are we defining success for our proposed project? Then how will we know that we are making progress toward our goals? So oftentimes, as I mentioned earlier, developers of evidence-based and promising models already specify evaluation outcomes and indicators. So one advantage of this is they have done the work for you. But one disadvantage is the outcomes are not always the ones you and or your stakeholders want. And another question is, what evidence can we show that we have achieved our outcomes? Mm-hmm. So you can post some questions if you have any questions for today. And if we do not get to any of those questions, you can submit them through our online question submission form. Just make sure you submit them by November 30, 2022. Okay. All right. And So Stephanie is helping us out today as well.
Yeah, Mia, I sent you a message, but a lot of the questions are about if folks will be getting the slides, and Mohammed is also answering in the chat box saying that we'll share the slides
Yeah,
in
thank
the
you.
RP webpage.
Thank you for your help. Yes, they will be available, not immediately after this one, but the slides, the recording, and the handouts that I just showed you will all be available on the EHDI RFP website or webpage. Okay. Okay. Okay, let's see. Get the slides. Mhm.
Yeah, maybe we can give him a minute or so, then we can probably close, Mia.
Yes. Yeah, we have some time left, so please feel free to ask your questions, and we'll do our best to to answer them. Okay. There's a question: if our program addresses multiple health disparities, do you recommend we submit more than one application to discuss the same program? And yeah, Mohammed, if they are unrelated, then they should submit separate applications, correct? Because sometimes, let's say you plan to propose something in the area of diabetes and heart disease and stroke, and those two programs are usually related. So if you want, you can just submit an application that covers both priority health areas. But if they are very different, for example, teen pregnancy prevention and infant mortality, for example, then they can be separate applications. What do you think, Mohammed?
Yes, that is correct. So it's really up to you whether you want to submit a single application or multiple applications. You can do either or. Both of them will be graded the same way or scored the same way. You will not get more points by doing either or. But yeah, so I think kind of what Mia suggested is really helpful to kind of maybe combine if they are related. Yeah.
Yeah, because sometimes the approach you're using is the same. So it can be a single application. Then another two areas that are usually related are teen pregnancy prevention and HIV/AIDS, STIs. So that can be part of the same application if you're using the same approach. And sometimes the populations you're targeting for both are the same also. So it makes more sense to just submit a single application. But if, for example, that you want to do teen pregnancy prevention and HIV/AIDS, STIs, but with adults, then it's recommended those be two separate applications because they'll be very different.
Yeah. Just make sure, again, obviously we'll have the community reviewers scoring in all this your application. So make sure that community reviewers are able to understand how each objective in your work plan is connected to the priority health areas that you're intending to address. So crafting objectives to include each priority health area is really a good way to ensure that your project aims to contribute to eliminating health disparity in what you are proposing.
Yes. Yeah, one of the slides I showed earlier was to really make sure that everything ties together. So the population you are targeting, and then the specific priority health area that you have selected, and then the health disparities that you have identified within that priority health area. You have to closely tie your activity strategies and approaches to what you have decided to focus on your efforts on. Okay. All right. If there are no more questions, I think it's a good time to to close the session. And again, if you have additional questions that you were not able to ask today, or that you thought about after the session, feel free to submit them using our online submission form, question submission form. Okay, thank you so much. Bye.